I'm here with Dr. Joy Leung of Tonghua Eastern Hospital. She's a retinal specialist there, and she's also the chairperson of Hong Kong Young Ophthalmologists. Welcome, Dr. Leung.
Hi, Matt. Nice to meet you.
Thanks so much. So, Joy, if I may call you Joy.
Of course.
Joy, you've mentioned that, interestingly, in Hong Kong, female ophthalmologists who are just sort of coming into practice now may have a leg up on male ophthalmologists. Tell me a little bit more about that.
Yeah. So in Hong Kong, we always have, for interns, for new graduates, there's a thing called Road to Success, meaning the four specialties, which are the good ones to go into for, better quality of life, including radiology, ophthalmology, anesthesiology, and dermatology. So ophthalmology being one of the most popular things that people like to choose for training, it's very popular. And rumors often say ophthalmology centers like to take female trainees, in particular pretty girls, to continue with the further training and so on and so forth. So I think in the recent years, there are many more trainees who are really just girls. And I think in my year we have 12 in total, and I think there are only 3 guys, and the rest are all girls. So,
that's an interesting point of view, and I guess on the one hand, maybe that's a success story for sort of women empowerment in ophthalmology to be able to get ahead in Hong Kong, because I know that in other places in the region it's not quite as easy.
I guess it's in Hong Kong, I guess, even back in medical school, I think there are more and more girls getting into medical school. So I think this might also be one of the contributing factors. Ophthalmology, I've spoken to some other male colleagues of mine in other specialties. Yeah. They think it's a little bit too small in a way for, especially those who want to be a surgeon. They, have maybe stronger egos, want to do something bigger, something more gross. And ophthalmology, is all the microsurgeries and so on and so forth. So it could be one of the reasons. But I guess girls do very well as well in Hong Kong, in ophthalmology in particular.
Now, I have to ask maybe a controversial question, but you mentioned a couple things. One being sort of the advantage of being a pretty girl, as you said, and also, perhaps going into this because of the delicate nature of surgery. If this is what's advancing careers in Hong Kong, is there any concern that it's stereotypes that are essentially allowing things to progress, or it's whatever helps to create more equality is actually a great thing?
I would put it this way. They are rumors. They are not essentially true. We welcome guys. We welcome all male trainees as well. But I guess once people have this strong belief, or students have this strong belief, when they apply, it's a fact that there are less guys applying. So in the end, when you are, say, a training center and you're interviewing, if there are many more girls to pick from, it's natural that you end up having more of them. Whether or not it's a stereotype, I think it's quite important to let our students, future doctors, know that it's not exactly a true thing. Sure.
Yeah. Well, and now that there are going to be more female ophthalmologists coming up in the ranks, is that a good thing? Or is the industry going to improve as a result due to
it's not fair you ask me, right? Given I'm a female ophthalmologist.
Give your biased opinion, please.
I think, as a female ophthalmologist, I think that one thing that is some very practical issues, I would say, that I myself have not experienced, but I have observed my seniors experiencing, say, pregnancy and surgeries. I'm a VR surgeon myself, and VR surgeries tend to be a bit longer than many other surgeries. Yeah. Sometimes all the back pain, the bump and everything actually makes life difficult.
Oh, yeah.
And it's a practical issue that I think, unfortunately, our male counterparts don't get to experience. So I think the other thing is striking a balance between family and work life. When you have kids, how do you, apportion enough time for your kids, and versus how much time do you put in your career? It's a thing that I think it's a motherly instinct as well, and I think it's a definite challenge that many female ophthalmologists will have to face. Not just female ophthalmologists, but anyone, a female doctor, would have to face.
Well, interestingly, Dr. Jemmy Chung also brought up that.
Yes.
And of course, her being from Singapore, I could see
Yes.
that's an interesting similarity between Singapore and
Yes, I
Hong
believe
Kong
so.
having the same experience in that regard.
Yeah.
Great. And, you know, what would you say to other regions out there, India, China, Vietnam, where I imagine the atmosphere is quite different for women in ophthalmology? How can women make a change to come into more leadership roles in the field?
I think it's difficult for them. I think it's a cultural thing, it's a society. I think Hong Kong, possibly having been a British colony, having a bit more exposure to the Western culture, we are very privileged to be to have a lot more equal treatment by the society. But I think after all, there are things that are biological that will never make us equal. I think first thing is it will be very hard, and they will have to work more. They have to be more hardworking than us, to put in more effort. And I think it's not something that an individual or even just a group of people can really change.
I don't know if you associate much with female ophthalmologists in the West, but do you believe that challenges in Asia Pacific overall are different for women here than in the West?
I think it's not necessarily. I believe it is just a matter of time. It's just a matter of it is a matter of development in the society, in beliefs. I believe it was not very different in the West maybe a century ago. Maybe 50, 100 years later, it will be a different world in Hong Kong or in Asia Pacific compared to the current situation.
So perhaps those countries that are less developed can look forward to more gender equality, looking toward the Hong Kong example.
I believe so, yes.
Excellent. Joy, thanks so much for joining us today and sharing a bright future for women in ophthalmology.
You're welcome.
Great.
Nice speaking to all of you.
Thank you.